Did you know that winter time is the ideal time for laser skin resurfacing? Well, cooler months provide the perfect conditions to tackle sun damage, fine lines, and uneven skin tone. But why is winter the best season, and what treatments are most effective? Hi, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist and laser and skincare expert. And today I'll explain to you why you should schedule your laser treatments this winter. So why is winter time perfect for lasers? During the winter time, UV exposure is significantly lower, which reduces the risk for adverse outcomes post-laser treatment like hyperpigmentation. Plus, the cooler weather makes it much easier to stay inside, stay covered, and protect the treated areas so that you really have that downtime you need to heal, especially if it's a more intense laser. One of the most common side effects post-laser treatment is hyperpigmentation during healing, and typically that occurs if there's unplanned sun exposure or unprotected sun exposure. When your skin's pink and healing from the laser, that is the time where it's essential to stay out of the sun and protect your skin from UV. So that even means sitting in front of a window if you work from home, or doing a lot of driving where you're getting UV exposure from the driver's side window. The other most common adverse event that can happen post-laser, especially those where we employ our resurfacing techniques, is infection. And this can occur if you're so eager to get out and about when your skin's still healing and there might be areas that aren't fully reepithelialized, meaning the skin hasn't fully recovered in certain areas. The more exposure and outdoor time your skin is subject to, the more likely it is to develop an infection. If you've made it this far, I'd like to thank you for supporting this channel. Please hit subscribe so you can stay up to date with new content every week. Now let's get back to the video. So there are a lot of options for laser treatments out there, but I'd like to highlight just a few top treatments for the winter. First off, fractional lasers are ideal for improving skin texture, treating acne scars, helping soften fine lines, and they do so with precision. Fractional lasers come in a variety of different types. The device that's right for you is likely going to be up to your board-certified dermatologist and laser expert. In our office, we use a fractionated laser called the Halo. Now, this is a hybrid laser, so it uses both ablative and non-ablative technologies. The ablative portion means that it treats the skin in a grid-like pattern, so a fractionated pattern, and it actually vaporizes little columns of tissue. It does so in such a precise manner that we're able to allow the untreated skin to heal very quickly, and the treated skin heals in a smooth manner and in a way where we're stimulating your skin to produce more collagen. Now, in that same beam where we vaporize that top layer of tissue, we're also delivering heat to a much deeper plane, and that is considered the non-ablative portion of the laser. So in a sense, this laser is able to sort of airbrush the surface of the skin and also deliver heat much deeper into the skin to stimulate collagen, to stimulate scar remodeling and wrinkle remodeling, and to stimulate elastin and hyaluronic acid. So the overall outcome post-laser is that your skin looks more radiant, less dull, smoother, the texture is improved, and we're able to tackle pigmentary changes on the skin like sunspots because we're treating very superficially. So we're able to achieve a more even skin tone. Now, typically with this device, we do suggest 2 treatments spaced about a month apart, and the best time to do it is in January and February when it's cold outside. Post-treatment, you feel like we gave you a sunburn, and so the face is a little bit hot for some time, so it's really comfortable to go outside and drive home with your windows down, which is one of the pro tips I tell my patients to help with the overall recovery. What's great about these lasers are they still are considered minimally invasive, and so there's a little bit of downtime, but not enough to throw off your whole social schedule. So most people will plan it around school breaks or long weekends, and they're able to get their treatments in and start the next week with glowing skin. Now, one really important fact about non-ablative fractionated lasers is that they have been shown in recent publications out of Harvard to actually help prevent the reoccurrence and new development of non-melanoma skin cancers. So these non-melanoma skin cancers are things like basal cell skin cancer or squamous cell skin cancer. and also something called actinic keratoses, which are pre-cancers. So patients who are prone to developing AKs or actinic keratoses and non-melanoma skin cancers should think about having a laser treatment done at least once or twice a year to really prevent the reoccurrence of those. At the end of the day, it's worth investing a little bit in the cosmetic space to help improve your overall skin health so that over time you're not undergoing the knife and in the Mohs surgeon's office cutting out some sort of skin cancer that's developed from years past of way too much sun exposure, which a lot of people have. Another great laser treatment option for the winter is the IPL or the BBL. So IPL stands for intense pulse light and BBL stands for broadband light. They're similar devices in that they deliver a broad spectrum of wavelengths to target both red and brown on the skin. So when you look in the mirror, if you see a mottled complexion where you have a bunch of brown spots and a bunch of dilated blood vessels, probably some sun damage, maybe you're a little bit more fair, IPL or BBL are great treatment options for the winter. Now, unlike a fractionated device where we're delving a little bit deeper in the skin to stimulate that dermal collagen, IPL and BBL treatments are very superficial. So really just targeting what's on the surface of the skin in terms of color, so reds and browns. Now, if you've never had a laser treatment or you're hesitant to delve into the world of aesthetics, it's important for you to know about this study. So there was a study done where blinded observers looked at the same face side by side. One face was covered with sun damage, so brown spots, red spots, it was just speckled. And the other face was the same amount of wrinkles, the same amount of changes related to aging, but without the brown spots and redness. And the blinded observers guessed an age difference between the two exact same faces, except for the tone. They guessed an age difference of 10 to 12 years different. So what that tells us is that people will perceive the same face side by side, less the sun damage, a 10 to 12 year difference. So this is a very interesting and important fact that I explain with my patients, that if you don't know where to start, or if you know you're looking older and dull and you just want to feel brighter, then cleaning up that surface of the skin can take years off. And I just quoted a study, so this is true. It's not just my imagination. And there are clinical studies to back the fact that evening skin tone can take years off. And so this is a great place to start. Now, what I mentioned at the beginning is that they emit a broad spectrum of light. So there's not one wavelength where we're targeting something specific like hemoglobin or melanin. So that's red or brown or water. So it's really targeting everything. And in darker skin tones, there's a high risk of burns. And in darker skin tone, especially in unexperienced providers or laser users or whoever has an IPL and is promising to treat darker skin, there is a large number of complications. And this is something that I see as a board-certified dermatologist. These complications walk into my office because untrained users use the wrong setting or chose to use an IPL on a dark skin tone. So caution my skin of color patients or anybody who is ethnically diverse or has skin that tans really well. It's important to say no to IPL or BBL. And I can say that from experience. Before I became a dermatologist, I went to an aesthetic practice where I asked for help to get rid of brown spots. I was prepping for my wedding, and the esthetician used an IPL on my back to help target some of the brown spots that I had from acne scarring in the past. And I got a barcode of burns across my back before my wedding. So imagine the heartbreak and makeup I had to use to cover that up. So unfortunately, I learned the hard way, but IPL needs to be in the hands of experienced users only and best used in lighter skin tone patients. Now that said, if you're of a lighter skin tone and you come in with self-tanner, or you just came back from vacation and your skin is tanned, then that's also a big no-no, because the IPL will remove the tan and you'll also have barcodes, maybe not burns, but you'll also have evidence that you were treated, and it's not treating your actual skin, it's just treating the tan. So a lot of things to remember about IPL or BBL, and hopefully when you go in for your consultation, your doctor, board certified dermatologist, or laser expert expert will go over all these things with you. So we talked about some great laser treatments for the winter. So there are also some laser treatments that can be used year-round, and I'll just mention them here. But the Clear and Brilliant is a great low-level, non-ablative laser that can be used year-round, as well as your laser hair removal devices where we're removing hair in sun-protected areas, as well as lasers for redness like the pulse dye laser. That's something that can also be used year-round. We do resurfacing treatments in the summer months, but with the precaution that after that treatment, you will go home and you won't see sun for a couple of days while your skin is healing. How to prepare and recover from laser. So prep requires avoiding the sun or any sort of tan or self-tanner for at least 2 weeks prior to the treatment. Now, if you went on a sunny vacation to the Bahamas and you're still tan and it's been about 4 weeks, that's important to note. Let your doctor know, send them in a picture, and make sure that you're cleared to have the treatment before you come in. Post-treatment, it's important to apply sunscreen and follow all the post-treatment skincare recommendations that are outlined and given to you by your doctor. If you don't receive those, it's important to ask for some sort of post-treatment plan. So typically, post-treatment skincare involves hydrating the skin, keeping a nice layer of moisture on the skin, and also applying sunscreen. We like mineral-based sunscreens for post-treatment healing, which include zinc oxide and titanium dioxide. They're going to be the most gentle on the skin in this post-treatment recovery phase. Also, avoiding too much outdoor time or outdoor activity, at least for, a few days post-treatment. Winter is the safest and most effective time for laser treatments. If you're ready to rejuvenate your skin, now's the time to book your appointment. If you enjoyed this video, make sure you like, comment, and subscribe for more dermatologist-backed skincare and aesthetic tips. See you next time.